Welcome back, everyone. Dr. Dennis Morris is back with us today from Lima Memorial. He's the Vice President of Medical Affairs, also the Chief Medical Officer there. We're talking a little bit about the flu. First of all, give us a sense of how strong it is, how bad it is this year. It seems like it started earlier, too.
Well, as predicted, it did start early, and it is very prevalent. And also, of course, we are in this area, have COVID at a very high transmission rate again. And then we're seeing the third part of that triple pandemic, the RSV in young children. That is kicking up also. So we have all three to deal with.
Yeah, I know you guys are dealing with that at the hospital and folks coming in. Is it possible to have symptoms from more than one of those, RSV and COVID or flu at the same time? Or are they kind of a distinct set of symptoms that you can get?
No, actually, they have very similar symptoms.
Okay.
They're all three respiratory viruses. You could have one or two of them at the same time. That's not real common, but it's not impossible. But yes, their symptoms mask each other. And so it is sometimes difficult to tell which of the viruses you have.
Now, if we get one or more than one of those, what's our treatment options there?
Well, again, like with COVID and the flu, both, if the symptoms aren't too bad, the traditional symptoms, maybe cough, congestion, tiredness, muscle aches, headache, those types of things, the best thing to do is just stay home, rest, use some ibuprofen or Tylenol for the headaches, and then and lots of fluids. If your symptoms worsen, particularly would be most characteristically would be shortness of breath. If you start having breathing problems, then you need to seek more help. A lot of people have the home test kits for COVID. You can test yourself. If you're positive, call your local healthcare provider. There are oral medications now that you can treat if you get on it early, and you can use that. If it's the flu, there's Tamiflu that's been around a long time. That can be done, also prescribed as an outpatient. So you don't necessarily have to come to the emergency room if the symptoms are minimal to moderate. Emergency room visits really should be for the more severe symptoms.
What are some of the prevention things? Obviously, we've got vaccines out there. Some people, for some reason, still don't take them. But there are vaccines available, and we think about hand washing and those kind of things. Are there prevention efforts we can take?
Well, it's the same preventative measures that we took during the COVID pandemic. It's still a pandemic, but you're right. Number one, the flu vaccine has been around for a long time. We know it's safe, and it's not too late to get that. And again, to dispel that myth that getting the flu vaccine is not going to cause you to get the flu. So it's very safe and effective. So we encourage that. Secondly, as you mentioned, the COVID vaccines are also readily available. And so you should get whatever you need to get boosted up. So you're up to date with the COVID vaccines. And then just the general hygiene procedures, frequent hand washing, social distancing, particularly if you have symptoms. Stay away from your family and friends that don't expose all them. And it's not inappropriate to wear a mask. People that particularly have immunocompromised states, they're susceptible to diseases, they should mask up and take all the precautions they can because the virus is all around us.
All right, play it safe. Dr. Morris, good advice. Appreciate it. Thank you so much.
Thank you. Happy holidays.
Same to you. Nice chatting with you. We'll be back after this.